Too often, we take our kidneys for granted. Since our kidneys work silently for us in the background, we incline to think that our kidneys are always enduring and shatterproof. Chronic kidney disease is an umbrella term for the majority of the renal conditions. It can be thought of as a thief that works quietly at night without creating any disturbance. However, it can diminish the quality of life significantly. Here is what is ahead on today's episode of Health and Flavor as we take a look at the topic of chronic kidney disease.
In fact, because of the nature of how they retain water, their diet should not have salt in it, or whatever salt they take should be measured.
It's usually very common.
Yes.
By the time you start getting cravings, it means you have imbalances.
Okay.
Yeah, that needs to be addressed.
All right.
So it's important that we address those cravings.
1, yes, feel it on your bum. 3, 4.
Do you think you know enough about your kidneys to keep yours healthy? We walked in our streets to find this out from the public. This is what people had to say.
It is when your kidneys fail because of certain aspects or maybe some infections or diseases that are affecting it. Yeah.
Possible factors that could contribute to kidney disease?
Either intake of salt, high intake of salt, yes. Drinking, I'm not so sure, but yeah. Yeah.
Actually, it goes where it's whereby a kidney cannot function properly due to some abnormal condition in the body, like it can cause by high blood pressure, high blood sugar level. So those are the things which actually cause kidney problem.
In my understanding, it's like your kidneys failing, not working as they should be. I can't say I'm quite familiar with all the functions of the kidneys, but I would say being able to break down, okay, not food, but being able to remove waste. Yeah, that's what I would say. So I would say maybe an inability of the kidneys to do that. Yeah. I think alcohol, excessive alcohol taking, yeah, that or eating lifestyle, diet. Yeah, that's what comes to mind. I would say where alcohol is concerned, yes, in Africa, yes, but I would say also chronic. For it to become chronic, it's also lack of access to proper healthcare. So that's why I would put in it being prevalent. So I would say it's prevalent mostly because of lack of access to adequate healthcare. Yes.
And personally, have you had this state of your
No. Yeah. I think it's one of those you feel fine. So if it's not broken, what are you fixing kind of situation? Yeah. So I've not had my kidneys checked per se, but I've had like a body check, like blood work, and I've not really had any issue.
It is a simple medical checkup that can lead to an early diagnosis of potential kidney problems, and thus treatments can be tremendously effectual. It is possible to slow down or even stop the progression of kidney disease, but should chronic disease become a lifestyle, then the full range of treatment options remain available. Our doctor had this and more to share.
Chronic kidney disease is a slow and progressive loss in kidney function. It is slow and progressive in the sense that it happens over a very long period of time. It will surprise you to note that even with only 50% or 60% of your kidneys functioning right, you'd not even notice any problem. There's so many people who walk the streets and they only have one kidney, and even that one kidney is only at 50%. So chronic kidney disease is a very slow and progressive disease. It happens over a long period of time. The signs and symptoms of a patient suffering from kidney disease commonly include blood in the urine. So when you urinate and you see blood in your urine, you should come in for proper checkup and screening. We have patients who have swelling. especially swelling like in the lower limbs, in the legs, swelling of the hands, generalized body swelling, even of the face and the abdomen, all around the lower part of the abdomen. Any swelling which the reason is unknown makes you a candidate for chronic kidney disease. And now the others are more non-specific and can be seen even in other patients. And so these ones are like nausea, which is common in most diseases we have talked about or will talk about. Issues with frequency, urinating more frequently than normal, or not urinating at all. The factors that predispose our patients to, or people in the population, to chronic kidney disease include one, presence of an ongoing kidney disease. So by the time it gets to chronic, the earlier phase for chronic is called acute kidney disease. So a patient with an acute kidney disease may eventually develop chronic kidney disease. But more commonly now, for patients with things like other diseases like diabetes, they are more predisposed also to develop issues with the kidney. And then we have toxicity, where it can either come in the form of chemicals in drugs, which may injure the kidneys because of either overdose or particular components in the drugs that someone is taking that end up injuring the kidneys. Some of the others are drug abuse. Patients who abuse drugs of whichever nature, even things like paracetamol, taken in excess, may affect particular organs of the body. And then we have patients who come up with chronic kidney disease as a result of a previous injury to the kidney. For chronic kidney disease, treatment per se is not a target at a cure. It's a target at managing the complications and making the life of the patient better. And for us, when we are dealing with chronic kidney disease, we're trying to improve the general output of life for the patient. Chronic kidney disease may present in the form of, with the symptoms, one of them is like inability to pass urine. And so medication or treatment in this sense is to allow the kidneys to be able to process and pass urine. And one of the other complications is like end-stage now kidney disease, which may actually require kidney transplant. For most patients, by the time they get to chronic kidney disease, which we call CKD, the eventual treatment for them is actually a kidney transplant. But then not all of them get there. Even if they don't get there, we put them on things like dialysis, where the kidney as an organ is aided in clearing out waste from the bloodstream. Patients who suffer from kidney disease are encouraged to go on a strict diet. In fact, because of the nature of how they retain water, their diet should not have salt in it, or whatever salt they take should be measured. If they are still mobile, then we always encourage them to work out, exercises that they can tolerate. This can be walking, can be jogging. For the treatment of kidney disease, there are some side effects that are known. And this is because one of the things that we do in the treatment for kidney disease is dialysis. And dialysis on its own is a kind of a painful process, and the effect there is needle pricks. And needle pricks, some drugs that are added onto it to clean the blood. That presents, like all medications, with nausea, a bit of GI discomfort. But generally, eventually we say that the best form of treatment for people with chronic kidney disease, before they get to the end stage of the disease, where the end stage of the disease is that the kidneys are working only between 10 to 15% or less. Before they get there, normally we try to encourage them to get onto the donor lists and get into donor transplants so that they get transplanted kidneys. Chronic kidney disease, in conclusion, I would say has a number of risk factors which our viewers need to be aware of. And it's commonly seen in patients who are older, like older than 60 years. It's also commonly recurring in patients that already have a family history of the same. We also see it in patients who have a history of alcoholism and substance and drug abuse. So it's just about watching out for risk factors and taking care of ourselves. Everyone should be able to drink as much water as they can take. Mostly it's recorded to be about 8 glasses a day. As much as someone can take, do not over-drink water, but rehydration, call that rehydration, is very, very good for your body and is very good for your kidneys.
Have you ever thought of water as a health enemy? Well, it is common knowledge that water consumption is imperative for maintaining good health, flush out body toxins, boosting immune system, and many more good things. Therefore, we are all encouraged to drink a lot of water. However, what most people do not know is that too much water is not good for patients with chronic kidney disorder. Let's listen in on these remarkable facts as presented by our nutritionist, Kefa Nyanumba. Hello everyone, welcome to Health and Flavor. This is our nutrition segment, and with me I have Mr. Kefa Nyanumba. He's our nutrition expert. Hello, how are you?
Fine, thank you.
I'm glad to have you here.
Thank you so much.
So today we are looking at a case study of chronic kidney disease.
Yes.
And we are having our patient who is a 65-year-old female. Her name is Beatrice. This is not our patient's real name. So then with the chronic kidney disease, there's some complaints that our patient was having, which you relate to kidney disease. Yeah, you like itchiness, trouble sleeping,
yes, and,
swollen ankles.
Yes, those are some of the common conditions.
Blood in the urine.
Yes, it's actually true. Those are some of the common symptoms that many people should complain about, especially the ones who have kidney disease. Okay. And it's important for us to know that our kidneys are actually very important. Everybody has two, and they assist us to get rid of toxins from the body.
All right.
Yeah.
Her dietary history, we see that she takes a lot of proteins.
Yes, proteins.
Chicken, beef, beans.
Which are some of the foods we actually recommend, especially as part of our meals.
She even takes legumes like green grams.
Yes, but for the people who have kidney disease like Beatrice, they need to start introducing some dietary adjustments. And because of a weak immune function, they need to make sure that they control their protein intake by cutting down the amount of protein that they are taking. Because proteins actually are broken down to urea, and the kidneys usually overwork in terms of getting rid of the urea. And in this case, we are not just talking about the red meat. We are talking of all the proteins, including the legumes, like some of the proteins we have in front of us.
Yes.
The
green grams.
Yes, the green grams.
Okay.
Yes.
I see she takes a lot of black coffee, and also some. She also likes taking yogurt and peanuts.
Yeah. Now for the black coffee.
Yes.
I would advise that she cuts down the black coffee. Okay. Yeah, because of caffeine. Yeah. So caffeine is not very good because it also interferes with the absorption of certain nutrients.
All right.
Yeah, so it's important that she cuts down her intake of black coffee.
So how about the yogurt?
Yogurt, of course, can be part of the snack or can be taken anytime, but still is a protein that also needs to calm down in terms of the quantities. Okay. Yes.
And she also likes snacking on peanuts.
Peanuts, yes, peanuts are good, but they're still actually proteins, so it's important that she also tries to cut down her intake of the peanuts, because as I said, of course, proteins tend to overwork the kidneys when it comes to elimination of urea. All right. Yes.
So it does not matter how they're prepared, whether it's oven, boiled, fried.
Okay, preparation is always important. Peanuts. When you talk about our food intake, preparation is very, very important when you talk about any food. All right. So for example, roasted peanuts that are salted are worse than the ones that are not salted, because we're also trying to make sure that we cut down our sodium intake. All right. Because our kidneys are actually the ones that assist to get rid of the sodium. So I would prefer roasted but unsalted.
All right. Okay. Yes. So as she's cutting down, the best way to cut down is she can occasionally take peanuts.
She can take peanuts like handful is not salted. All right. That's fine.
Okay. And so let's also talk about her cravings. I see she craves for sugary foods, cakes, chocolates. So
cravings are very common.
I've noticed that these lifestyle diseases, it's almost as if they come with some craving that the patient is going through.
Yeah, cravings usually very common. Yes. By the time you start getting cravings, it means you have imbalances. Yeah, that needs to be addressed. All right. So it's important that we address those cravings. All right. And of course, for our case, she has cravings for sugary foods. Yes. And it's important for our viewers to understand that two of the most leading causes of kidney disease is actually hypertension and diabetes. Yes. So for people who have cravings for sugary foods. A number of them usually have what you call insulin resistance. And of course, that's why we need to address those cravings. Like she cannot afford to take sugary foods like cakes, for example, sweets. She's not supposed to take some of those foods. Because that should tend to interfere with the normal kidney function.
Okay.
Yeah.
She also enjoys taking fruit juice. She takes some tots of whiskey and a lot of water.
Okay, let's start with the fruit juice.
Yes.
We know that, of course, she can get nutrients from fruit juice.
This is fresh fruit juice.
Yes, fresh fruit juice. But I would prefer that most of the days she takes a fruit instead of a fruit juice.
But a patient would ask, what's the difference between the juice and the fruit? Actually, it's still one and the same thing.
Yeah, the difference is in terms of fiber content, which is very important for digestion.
Yes.
And there's something called the glycemic index of the fruits. Usually, fruit juice tend to have high glycemic index compared to, for example, fruit.
Okay.
Yeah, especially for someone who has kidney disease, I would not really recommend that.
All right.
Yes, unless it's once for a while.
Okay.
Yes.
She takes a lot of water. And interestingly,
You know that everybody needs water.
Yes. But interestingly, from your point of view, a lot of water may not necessarily be good for patients with chronic kidney disease.
Yeah, which is true.
Okay.
We know that water is very good for everybody, including me and you.
Yes.
But in this case, she needs to make sure that she cuts down her water intake.
Yeah.
Not because water is bad, but because, water will tend to overwork the kidneys in terms of elimination.
All right.
Yes, our body usually tries to ensure that we have a balance in terms of fluid. So if you take excess, it has to get rid of the excess.
Okay.
And that will tend to overwork the kidneys.
All right.
So she needs to cut down her water intake.
Okay.
Yes.
And for someone who say, I'm so used to taking a lot of water, how will I stop that? How can I just stop taking water all of a sudden?
Okay, it has to be done in a gradual process.
Okay.
Yeah, because by the end of the day, we know that water is good, but at this point, we are so much concerned about the kidneys.
Yeah.
Yeah, which are very, very important organs. Without kidneys, of course, we'll not be able to get rid of the toxins from our body.
All right.
We don't want a case whereby, some of our patients go for dialysis because of kidney disease. So it's important that she tries to moderate her water intake. But she can also get water from so many other sources, like fruits like watermelon, actually very good sources of many nutrients, including zinc. Plus, they have a lot of water as well. So if somebody is taking watermelon, for example, pawpaw, etc., they can still get water. So
I see you can also eat the seeds of the watermelon.
yeah, seeds are good.
Yeah.
In fact, they contain zinc.
Yeah.
Which is a very important nutrient when it comes to the coordination.
All right.
Yes.
So how about the carrots?
Carrots are very
She
good
can
in terms
snack
of
on carrots
can be part of
instead of snacking on the peanuts.
Yeah, sometimes for change.
For a change.
For change, yeah, it's okay. Carrot sticks can be good as snacks, but you can also use carrots when cooking.
Okay.
Yeah, they are very good for vitamin A, which is important when it comes to our immune function.
All right.
When you're talking about most of the conditions and all that, we should not forget our body's defense mechanism, our immunity. We need to make sure that we boost it.
Yes.
So some of the foods that can boost our immunity, of course, include the fruits, the vegetables, carrots, etc. Yeah.
I see that. And so then you also introduced that it is important that she takes whole fruits.
Whole fruits, yes. I think I've already explained about that. By that I mean instead of fruit juice, you can take an orange.
Okay.
Yeah, I think I've already explained about that.
I understand that.
Yes,
I understand.
Yeah.
So then so this marks the end of this segment.
Yes.
Yeah, so thank you so much for taking your time to be with us here.
Thank
for
you.
our viewers back at home, this marks the end of this segment. Up until next time, for us, it's goodbye. Simple exercises can help improve the health of patients with chronic kidney disease. Since heart disease typically develops in patients with chronic kidney disease, keeping fit and making exercises a lifestyle is vital. We got some insight from our fitness expert on the kind of exercises that are suitable. Hello everyone, welcome to Health and Flavor. On this fitness segment, we are going to look at kidney disease, and on set we have a fitness trainer who is also an expert, Mr. Nzuki. How are you?
I'm fine, Bill. How have you been?
I'm fine, thank you. So then we would like you to take us through what we are going to do today, the kind of exercises we're going to do.
We'll start with warming up, and then after a short warm up, we'll do a warm up stretch, right?
All right.
So we kick the diagonals like this. Diagonals. Let's go.
With the left hand tap the right foot.
Yes, let's go. 1, 2, yes, 3, 4, 5, 6, 7. Now kick straight. Let's go straight. 2, 3, 4, higher, 5, 6, 7. Now side, let's go side. Let's go 2, 3, 4, higher, 5, 6, 7, 8. Now back, let's go 1. Let's go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now it's now time to stretch. Now flex. Remember, we are getting ready for a walk or a run or a jog. Are you there?
Okay.
Now take it set. Go for it. Go. Yes. That's 5, 4, 3, 2. Let's change. Let's go. Take the other leg. That's 5, 4, 3, 2, and 1. Flex legs. Cross legs. Now back. Join both arms at the back like this. Yes. Let's go down. Keep going. Yes. Feel your calves tightening.
Okay.
Yes. Feel the stretch. Then let's change the other leg. Let's go. Let's go. That's 5, 4, 3, 2, and 1. Okay.
Next, we're up for a jog. All right.
Your arms down there, bend 90 degrees. Then you cross your legs at the back and you lift your weight, your body above the mat. You hold there. We normally do it for, like, you can decide if you have your timer, you do it for that seconds, you'll feel it. Just hold there as I count for that seconds. So let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9. You hold there. There are no mountains and no valleys. So your spine is in a neutral position. Eh?
Can both men and women do?
Yes.
Okay.
He's for both. So you hold there. And this one, you tighten your abs. Yes. This one is a bit tight. So I'll only count for you 5. 5, 4, 3, 2, 1. I want us to kick like a donkey. It's called a donkey kick. You kick up. You involve your glutes, these muscles of your bum. Push it up. Then push it up. 2 more. 1 more. And then you change. Let's go up. 1. Yes, feel it on your bum. 3, 4, 1, 2, 3, 4, 5. Let's change. Let's go. 5, 4, 3, 2, 1. Good.
All right, viewers, that's what we had for today, right? So we are wrapping it up, but as for me, I would like to continue jogging. I've enjoyed these exercises and I want to make it my lifestyle. So, see ya.
Kidney disease often has no symptoms, and it can go undetected until very advanced. It is important to get tested because early detection and treatment can slow or prevent the progression of kidney diseases. The two main causes of chronic kidney diseases are diabetes and high blood pressure, which are responsible for up to 2/3 of the cases. Number one, manage the underlying condition such as high blood pressure and diabetes mellitus. If these are managed properly, you significantly diminish the chances of suffering CKD. Number two, smoking increases your risk of cardiovascular diseases. This is associated with a high risk of kidney disease. Ceasing to smoke will improve your general health and reduce your risk of advancing to kidney disease. Number three, a balanced diet can reduce your risk of kidney disease by keeping your blood pressure and cholesterol at a healthy level. It should include fruits, vegetables, whole grains, low-fatty dairy products, and lean proteins. Adhere to low intake of salt, sugar, and saturated fat. In addressing challenges posed by the worldwide CKD pandemic, diet and lifestyle modification, as well as tight control of diabetes and hypertension, are imperative. Stressing potency policies that keep highly effective drugs out of patient reach should be emphasized.
With timely diagnosis and expert care, only a small proportion of those with chronic kidney disease will have the need for a dialysis or a transplant. It is easy to take those first few steps towards securing kidney health. Early intervention is the key here. People tend to spend so much time and money on safety for our possessions and material belongings, yet statistics have shown that our own health has been given little priority. Thanks for watching this week's episode of Health and Flavor. I have been your host, Bill Hawaka. Until next time, it's bye for now.